Good afternoon. Welcome to Pink Bathrobe Talks and trying to figure out Medicare and my coverage and getting copay assistance. First of all, I must put a disclaimer up. This is my experience only. This may not be everyone's experience. This is my own personal experience, and it's good to document it, and maybe I can help someone else out there. I would also like to say that anyone between the ages of 75 and 90 years old could not figure this out if they were paid $1 billion to do it. But you know what? I'm at a good point. I've reached another precipice. So, as many of you know, I take a biologic for my psoriatic arthritis, which is a progressive disease. And depending on how well I take care of my body over the next 10 years is going to determine my mobility, my ability to walk up and down stairs, my ability to drive, and my ability to continue to walk upright on both feet. Use of my limbs. It is a debilitating disease and it is progressive. So, in order to continue to make this health journey worthwhile, I've been working very diligently with my doctors and pharmacists and a lot of company representatives who I have to say have been nothing but nice for me to me in trying to figure this out. And of course, you know, I'm a shiny person. You catch more. You catch more people with honey than you do vinegar. That's for darn sure. So we last left off to where the specialty pharmacy had received the prescription from my current healthcare provider. And then the Medicare insurance company I'm with had initially approved the dispensing of the medication, which left me with a huge copay. And the pharmaceutical company who would pick up the exuberant or a portion of the large copay in order to make it affordable to me on my Social Security income. And for others who are also on small Social Security incomes as well. So today I received a letter from my Medicare insurance company that my prescription had been denied. My pre-authorization request had been denied to the specialty pharmacy that would dispense the medication and deliver it to my home. And it is a biologic. It is an injectable biologic. I need this medication. I agreed with my doctor that this was the best route in slowing down the progression of my disease. Facts. So, just to give you an idea of how many people I've talked to today. So, I've talked to the specialty pharmacy 3 times, 3 different phone calls. I have talked to my Medicare insurance provider. Please remember that I pay for that out of my Social Security check income. Okay, so which brings my income down to even less. Was rerouted several times through the Medicare insurance company, twice back to a pharmacy that was no longer accepting the prescription at all. I eventually got routed to an appeals advocate because I had a denial letter, and she worked so diligently. She found my information on file that indeed it had been approved to be dispensed by the second specialist pharmacy, and I could go ahead and continue to get that medicine dispensed. Now, on my small little income, Social Security income, I cannot afford to pay for this medication on my own. So I had then had to go back to my savings card plan, which is issued to me by the pharmaceutical company that provides my medication or the biologic. I was told by the pharmaceutical company that they would not help with the co-payment because it is a government funded health plan. That that my savings card plan numbers and RX help would be revoked, which was done. And now, in order to move forward with the copay assistance, I would have to apply for patient assistance all over again, in turn having to provide them with last year's tax returns. Now, we all know my husband makes considerably more money than my Social Security check, but in order to be approved, I have to give them this tax refund from the federal government to a big pharmaceutical company. And so I'm going to exhaust all avenues. And if I'm denied the copay coverage, I'm going to have to start this process all over again. And it's not very much fun. I do not want to have to choose between being able to make a payment for my medication or my mobility. That's how broken this system is. I see why so many elderly or people with no mental fortitude could make it through this system and give up. Well, I'm not giving up. I'm going to ride their asses till the end. And I'll let you know how it goes. So I think this concludes Pink Bathrobe Talks about my journey through Medicare. So I'm just hoping that I can get this done in time. 10 out of 10, do not recommend. I hope this helps someone out there. I really do. It's difficult. It's not easy. And I'm shiny. And I'm nice. Man, I could have went off on any of those representatives. But you know what? It's not their fault. You know whose fault it really is? It is our government's fault. I pay for my government-funded insurance out of my Social Security check. They should be willing to work with and cooperate with these big pharmaceutical companies without it being this complicated. Or a pharmaceutical company needing to know, my total income and my husband's and my father-in-law's and anything else. Anyway, I'm signing off. I need to shower. And I hope you guys have a good rest of your day. Bye.